Hello, my name is Faisal, and these are a few common questions I come across from the patients regarding how to take care of themselves once the surgery is done. Once we finish the procedure, you'll still be numb. Numbing could last for about 1 to up to 5 hours depending on what kind of anesthesia we have used for you. So during this time, you got to be a bit careful not to accidentally bite on your lip, your cheek, or your tongue. Pain is expected after a dental surgery. Depending upon the nature of the procedure, it could be mild to severe. For example, if you have got a procedure where a simple tooth removal has been performed, the pain might not be bothersome so much. However, if it's a more complex procedure where a surgical extraction has been done, which needed opening of gums or trimming of bone or sectioning of tooth, in the scenario, pain can be quite bothersome for the first week, especially in the first 3 to 4 days. Then it starts tapering down. After the surgical procedure, bleeding is expected. So you can expect some bleeding for the first 48 hours, especially during the first 24 hours where the bleeding is going to be much more. And we want to keep the bleeding to the minimal. So here are a few things what you're going to do. Firstly, when the surgery is completed, you will be biting onto a piece of gauze for the following 1 hour before you get the gauze out. This helps in putting the pressure and controls the bleed. It's not really necessary to replace the gauze after an hour unless it's bleeding too much. Second thing, avoid anything hot. Hot aggravates bleeding. On the other hand, if you're taking cold food, that helps in controlling the bleed. Thirdly, avoid speaking too much for the first 24 hours. The more you speak, the more it bleeds. If in case the bleeding is too much, which could sometime happen, please use a tea bag, place it in that area and bite onto it. The tannins from the tea bag helps in controlling the bleed as well. It's not necessary to do it, but this is only advisable if the bleeding is too much. A note of caution with bleeding: if someone is taking strong blood thinners or they have a genetic condition where they bleed too much, and if you're noticing the bleeding is quite high, that means in an hour you're bleeding a cup or more on day 2. This is something which is not expected, and you need to either get back to the office or go to an emergency if this happens. Although this is rare, it's important to know. Bruising is expected after a dental surgery, so I don't want you to be too worried about it. People who are taking blood thinners or who are genetically prone to bruising will show some bruising around the chin area. Usually starts showing up on day 2 or day 3 and starts disappearing on day 8 or day 9. So please don't worry about it. That is natural and expected. Situations where a complex tooth has been removed surgically or where multiple teeth have been removed, there can be swelling expected starting from day 2. The swelling keeps going up for the first 2 to 3 days before it starts coming down. So generally it takes about a week's time for the swelling to ease up. Due to the swelling, you might have difficulty in opening your mouth, swallowing. So please don't worry, that is expected. By the end of first week, you will realize the swelling is easing up. In regards to the diet after the procedure, 2 things are very important. One, keeping yourself well hydrated. Secondly, keeping yourself on a food which is nutritious but easy to eat as well, requiring minimum chewing. I would suggest yogurts, lots of yogurts, because it also helps in protecting your tummy from the medications which you are taking. Another great recommendation are smoothies, which require minimum chewing, but it also gives you good nourishment. During the phase of healing, it's very important to take good care of the hygiene in the area where the healing is happening. Mouth is prone to infections much higher because it could catch up food while you're eating, which could stay into that area, causing an infection. It's always wet, a perfect area for it to get infected. To make sure the area remains clean and prevent infection, you got to use warm salt rinses to keep that area clean. If the risk is higher in your scenario, we would be prescribing you some antiseptic mouth rinses which will prevent infection. You can brush the other teeth where the surgery has not been done. That should be absolutely fine. But in scenarios such as wisdom teeth removal, where it becomes difficult to open your mouth, just using the mouthwash and the warm salt water helps good enough to keep that area clean. I want you to understand the mouthwash or the warm salt rinses shouldn't start immediately after the surgery, as rinsing action will aggravate the bleeding. I suggest that you start using the mouthwash or the warm salt rinses once the bleeding is completely stopped. So at least after 24 hours, and continue it for the next 2 weeks. If we have used sutures in the area, we'll keep you informed what kind of sutures we have used. Usually there are two types. One which fall off by themselves in about 3 to 4 days time. The second one which we need to remove after 2 weeks. If you have been prescribed medications, my nurse is going to take you in detail how to use it. Please be mindful the medication needs to be started 1 hour from the surgery so that the medication start working before the numbness wears off. This helps to reduce the painful time which you could have between the two. So 1 hour from the surgery, you're starting with your pain medication and any other medication if prescribed. I wish you all the best with your healing. Please remember to be kind to yourself. Take good care. Thanks.